From the California State Senate, this is Senate Spotlight.
Hello, everyone, and welcome to this edition of Senate Spotlight, where we discuss legislative policies and priorities and other related issues with members of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green, and joining us this time around is the Honorable State Senator from the 24th Senate District, Dr. Ed Hernandez. From Azusa, and your district goes clear from, I guess, the East San Gabriel Valley all the way to East LA. Is that pretty? Yeah,
that is correct.
Yeah,
Thanks.
You are the chair of the Senate Health Committee, a practicing optometrist. We're glad to have you. Thanks for joining us.
Thank you very much, and I appreciate the invitation. It's great to be here.
Well, we are going to devote the body of this discussion here to the extraordinary victory that you are fresh on the heels of here in the legislature on behalf of California's young people, really on behalf of all Californians in general. Governor recently signed into law your legislation that increases the legal age to buy tobacco from 18 to 21. Right. I guess it's as simple as that, really. But tell us about Tobacco 21. Tell us about this legislation, this new law.
Right. Well, it may appear to be simple, but it was a very difficult piece of legislation.
And we will talk about that,
to move through the legislative process. But I'll tell you, it was a huge victory, not only for California, but I believe that the rest of the country will follow, and we not only are going to make sure that young adults do not get addicted to tobacco, but more importantly, save lives and reduce healthcare costs. That's the bottom line.
And when it comes to implementation, you know, I don't want to use the word simple in a loose way, but really you're kind of a copy and paste law that what applied to 18 and under now applies to 21 and under, right?
Yeah, I mean, currently we have a system that's in place. And anyone wants to sell tobacco products or cigarettes in the state, they have to register with the state of California, they have to have signage, they have to ask for ID, and that ID is you have to make sure they're 18. Nothing changes. The same mechanism is in place. The big difference is now you have to ask if you're 21. And it's actually easier because if you look at the driver's license that we have, they're vertical for under 18 and they're horizontal with a picture if you're over 21. So it just makes it even easier. But the system's there and it's going to work.
Which government entity is going to be enforcing this when it becomes law in June?
Yeah, well, it'll be the ABC where they're licensed under, and as you know, they currently will send out, undercover individuals that are young, under the age of 17 or 18, and they'll go and solicit to buy, and if they buy, then they get fined, the stores, and sometimes even their license is revoked.
Tell us, break down a little bit more about the health costs and the savings, and what this means to Californians in terms of quitting smoking and not even having access to it as a gateway addiction, so to speak.
So if you look at our healthcare cost, some of the biggest cost drivers are due to tobacco and its effects: emphysema, lung disease, heart attacks, high blood pressure, cancer. Lots of expense goes into healthcare. But if you also look at what the tobacco industry has done in the past, is they try to target adolescents or young adults to get addicted to tobacco. Once they get addicted, they're going to be lifetime smokers. And studies show that if you smoke before you're age 21, you're most likely going to be addicted for life. So by reducing the number of young adults addicted, in the future, we're going to get immediate impacts where we're going to reduce the healthcare costs. Currently, there's about $18 billion of savings that's going to come to our healthcare system, and just in California alone, is $3.5 billion to our Medi-Cal system. What better way to save lives but also control healthcare costs?
Well, you mentioned the tobacco industry, and it's really interesting how calculated some of the research and some of the reading I've done, how calculated they are in this approach, particularly to young people. When they talk literally about the addiction process, they want the addiction. It's not just we want to increase sales, we want to get them hooked literally in order to be able to have lifetime customers.
Yeah, well, the reason is they're older or much individuals that have been using the product are dying off, and they have to get new customers to get addicted to their product, and that's why they market to kids.
And there's been some concern about kids still having access, but really, what are the odds of an 18-year-old trying to find a 20 or 21-year-old to get cigarettes, right?
So I mean, obviously I've been on social media attacks saying, if somebody could go to war and die for a country, they should be able to smoke, and they're going to get it anyway. Well, yeah, there's some truth to that, but as you mentioned, if you think about somebody that is 17, they're more likely to have within their social sphere somebody that's 18 that'll buy them cigarettes. as opposed that at 17 or 18-year-olds, less likely just from the fact that they're not in high school, somebody who's 21, and you're not going to get that social interaction. And the Institute of Medicine showed that there's going to be an immediate impact and there's going to be less individuals smoking.
And you mentioned the military personnel. In fact, you do have an amendment of the law that allows them the access, right?
Yeah. So within the legislation that the governor signed, there is an exemption. So if you're active military, you show military ID, you can still purchase if you're 18 years of age here in the state as well. But that's the only exemption that there'll be in the bill.
All right, we mentioned, of course, it's not simple, but I don't want to make you rehash every detail over the last couple of years. But walk us through the journey here of getting this public health legislation and idea into law. It's really what you guys have gone through, you and your colleagues, is really a great lesson, a great primer in the legislative process. Yeah. Talk about it a little bit.
You mean how we make sausage?
Yeah, exactly. Yeah, and I think it's important. Actually, they say don't watch it or don't look at it, but I think we should talk about it.
So if you think about what we do, a lot of what we do is all about ideas. And I would say about 4 years ago on a flight back from home to Sacramento, I was reading an article on the airplane, and it had to do with addiction, it had to do with young adults. And I started thinking, why don't we think about raising the age? And this is before Hawaii and even before the Institute of Medicine. So we thought about it, we brought in the advocates, they weren't really high on the idea at the time, and we waited a year later, we ran the bill, and this was under what we call the normal legislative process. Made it through the Senate, and in the Assembly we got bogged down in the GEO committee, which is the committee that deals with tobacco and tobacco products. So we knew the votes weren't there, we decided to wait. Well, the governor had called a special session for health care to deal with some taxes on the Medi-Cal system. We saw an opening, did it because it bypassed that committee, and we still ran into some problems at the end of last year, a lot of tension. And then fast forward to this calendar year, we were able to muster up the votes. There was a lot of strong arming by the opposition, and to the credit of my colleagues in the Assembly and the Senate, they put up the vote and decided to stand with young kids as opposed to big tobacco. And lo and behold, the governor signed the bill, and here we are.
There was one columnist who had said that you and your colleagues showed a surprising courage against the tobacco industry. Obviously, it was courage. Was it surprising?
You know, obviously I believed in the issue. I wanted to put the vote up, and I made sure that we did because I really believe that members in their heart were going to side with adolescents, and yes, it was courage because there was a lot of lobbying on behalf of the tobacco industry, and there was even, some threats that they'd go to the initiative and against members. But you know what? It all worked out.
And other states, other local governments are taking advantage of this. California is the bellwether in terms of a state, but I know Hawaii is doing something. What are some of the other municipalities, I guess you could say?
California is the second state. Hawaii was the first. But what I think makes California so unique is the size, but more importantly, the market share that we have. And you're going to see, how the saying goes, as California goes the rest of the country. But also there's other municipalities, East Coast, cities. I think there's, I believe, 17 states that have current pending legislation. So you're going to start to see that momentum shift, and you're going to start to see the tobacco industry dig in more and try to oppose any such measures.
There's a city I was reading about, in Needham, Massachusetts, about 30,000 people outside, a small city outside of Boston, which became the first municipality in the U.S. in 2005 to ban tobacco sales to anyone under drinking age. People were very skeptical. Well, what kind of effect is this really going to have? But between 2006, 2010, reading, the smoking rates in that city fell from 13% down to just a single-digit percentage. And I think now the smoking rate is the lowest in the rest of the state. So you have a lot of skepticism, but really this works, and it has an outlying domino effect on the rest of the state, if not the country. The illegal sales are minimal, if negligible. This obviously confirms what you're doing here in California.
Right. So let's talk about that city in Massachusetts. Yeah. There was a lot of critics that said, a small city, you're not going to make a difference. But when they look back and you read the article that the paper did on it, there was a significant drop that showed that young adults were not going to buy tobacco or buy cigarette products. And it was evidence that it works. So if you imagine that happens in a municipality or a small city, can you imagine what's going to happen to the state of California and the effect it's going to have on it? And if I'm not mistaken, even within that city, surrounding cities started to see an effect as well. So there is scientific evidence in showing that, especially with Institute of Medicine, that's showing in the future what's going to happen and the amount of money that's saved is going to be significant.
And it's been interesting, in addition to opposition from the industry, and I'll acknowledge they are not here to defend themselves in this conversation, but they've obviously pushed back against this. You've also had the skepticism from the scholars and some of the scientists and all. So you've had sort of a dual convincing, a dual pushback. Elaborate on that or comment on that a little bit.
Well, I mean, obviously, when you're dealing with a product that generates as much dollars as they do everything they can to change the argument, and that argument is, yes, they need to make their choice. It's going to happen. You're going to get the opposition. But I think the evidence on the other side, the scientific side, especially with the Institute of Medicine, with these cities, these municipalities, the health consequences and the safe that we're going to reduce costs, is going to far outweigh what the opposition has said.
It must be satisfying not only as a lawmaker, but also as a medical practitioner to see the arc of awareness and education move so directly to enacting these laws where the default, the new normal now, is not smoking.
Yeah.
I mean, and even in your industry, a couple of decades ago, a couple of generations ago, doctors were promoted. They were the spokespersons for the tobacco industry. Relieve your stress. It'll be medically healthy. Reflect on that a little bit in your career and just seeing this kind of change, particularly with smoking.
Yeah. So, as a healthcare provider, we see patients on a regular basis, and part of our history, even if you look at where the Affordable Care Act is and trying to reduce costs, that's part of the questions we ask. Social, do you smoke? Do you drink? How many packs? How much do you smoke? How much do you drink? The reason why is because we look at the whole health of the patient. So if they are smokers, if they are drinkers, if they have a family history of high blood pressure, diabetes, we can sit down and educate them and say, look, those are going to have health consequences. They're going to affect you. They're going to affect your eyes. They're going to affect diabetes. They're going to affect your vision. And that's all part of the medical history, So yes, we're part of that spokesperson to try to educate them. Yes, you have a choice to do it, but in the end, it's going to have an effect on your health.
As a legislator, what more to be done now as you move forward? The tobacco industry allegedly is panicked with these laws, but that could make things more difficult when they get into a defensive posture as you move on legislatively or even on the referendum. Does that make life more complicated for you, this victory?
No, not really. The reason why is because we all run, and I ran to make a difference and make some change. And I think this is a significant change that's occurred in, it's a legacy that's going to be here for decades to come. Now, the tobacco industry, like any industry, has every right to have a referendum, to go to the ballots, to get involved in campaigns, and they may or they may not. And if they do, though, the voters and the polling show that, yes, there's a significant number in the high 70s that they believe that we should change the smoking age to 21. And I believe that if they do go to a referendum and they put on the ballot, I think it will be rejected by the voters to overturn the smoking to 21.
And in fact, I should point out before we close up here that this was just one bill of a package, including e-cigarettes, other elements. Before we leave here, elaborate on that a little bit more, how this was just one piece of this whole victory here.
So if you think about what California in the past has done, we're known as the leader in tobacco, anti-smoking, not smoking in public places, etc. We kind of got away from that. Again, probably because of the big lobby by tobacco. Well, guess what? I believe we're now the leader again with this package of bills, not only my bill, but looking at the Leno bill that deals with vaping products. That in itself is huge because there's no regulation whatsoever. And now you're having an industry which was once small business, now large tobacco buying up vaping products because the young adults are getting addicted to nicotine. And they have flavors. They're going into schools. They're trying to get kids addicted. Along with the other issue, the other legislation that we're dealing with, we now have a package of bills that show that California is again the leader. I think the next thing that they're going to look at is trying to get on the ballot to raise the tobacco tax per box. At one time, we were the nation leader. Now we're amongst the lowest, and hopefully that'll make the ballot. And the voters will see that, yes, we need to raise the tax on tobacco.
Senator, thank you for your efforts to make California the leader in this important legislation. Good to talk to you. Hope to have you back soon. On the myriad of other issues that you are working on as chair of the Health Committee.
My pleasure. Thanks for having me.
All right, State Senator Ed Hernandez from the 24th Senate District, Dr. Ed Hernandez, and that is it for this edition of Senate Spotlight. And we invite you to join us next time around as we discuss important legislative issues and policies with the newsmakers and, very appropriately here, the newsbreakers of the California State Senate. From the state capitol in Sacramento, I'm Brian Green. Thanks for watching.
Thanks for watching Senate Spotlight.